Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert. Today, we are doing the Man on the Street podcast, man and woman on the street, actually, with my absolutely faithful and cringe-worthy co-host, Dr. Millicent Rovelo. I know you're dying right now.
So cringe, as my son would say, because we're not just on any street. We are on...
Scoot towards me a little bit.
We are on a street that has a billboard about the Beverly Hills Plastic Surgery Podcast. In case you're watching this and you didn't notice the giant billboard that's right above our heads.
It's right behind us.
That's us, right. On a billboard.
We have officially become a meme. I don't know what they're going to write, but it's going to be something bad.
It's going to be awful because we are literally a meme. Like, I don't know how we could be any more LA right now.
Yeah, I mean, there's a billboard over, we're on 3rd. There's one over on Sunset, but it was too far away. We couldn't drive all that way with the traffic at this hour.
No, it's 5:30 p.m. on a Friday. That 2 miles will take us,
it was easily like 30 minutes.
Easily.
Easily.
So we're a little bit closer. We are by the Beverly Center, which is, a fancy place on its own. So we're just down the street from the Beverly Center on 3rd Street in Los Angeles, doing a podcast in front of a billboard about our podcast.
And so let's do the podcast.
Yeah, so what do you want to talk about now that we're here?
So we just got back from the Aesthetic Society meeting in Miami, and it was awesome.
It was super awesome. This is the meeting we go to annually, usually about this time of year, and they always have it in really nice, fun, exciting places. And this year it was in Miami. We were in Miami in 2019, but it was so fun. We had to go right back.
Had
to go right back. So, no, it wasn't 2019. It was right after the pandemic. So it was
2021.
21. So, like, literally, we were just there. That's how fun Miami is. But that wasn't the point. The point is it was an educational meeting.
Yes. It was
really fun.
There was a couple of things. Some of the general themes that I noticed is that tech has really taken to plastic surgery in a big way. Like, there was so much new technology in terms of the machines and diagnostics and in minimally invasive. I was really into the fact that we're using power tools for rhinoplasty. There's, the piezo surgery, ultrasonic rhinoplasty, and power tools for dorsal rasping and all sorts of lasers for the body and the Morpheus. It was a lot to learn.
So much tech. And you could see that in the marketplace, which is their giant central market, literally, of every possible kind of vendor, selling technology for financing, for fillers, for Botox, of all varieties and name brands, the machines, the devices, everything you could possibly think of was at the marketplace.
And it was cool. I mean, I think it's, the tech is really evolving super fast. I mean, it is not like this specialty literally changes every 6 months.
Yeah.
Like, by the time we go to ASPS, it's going to be a whole nother ballgame. I mean, it really is. It's going very rapidly. And I think if you want to provide the best care for your patients, you kind of got to dig in.
True, but it's not just technology, it's techniques as well. So that's one of the really cool things I think about plastic surgery compared to many other surgical specialties, is that it's constantly changing. The way we do any given procedure changes. And generally for the better, because we continue to identify problems with our results and then come up with new ways to fix those problems. And so it's a constant evolution of our practice, which I think is really great.
Yeah, and I think I made a statement at some point that if you keep an open mind about technique, because it does evolve, but it also, there's a revisitation of some previously bygone techniques. For instance, preservation rhinoplasty,
deep plane facelift.
Yeah, I mean, these are techniques that have been around forever, but they've been polished, they've been dusted off, polished up, rebranded, and reintroduced, usually with some technical advantage for why they're being brought back. It's almost like, well, it wasn't that great then, but now, because we have these instruments and we have this understanding of surgical physiology, that now those techniques are relevant and they should be revisited and refined. And I think that any plastic surgeon that says, I never do blah, is somebody who is dogmatic. And I've always said this, and it's the Pittsburgh mantra: dogma will get you in trouble every time. You cannot be dogmatic. You will ultimately become a dinosaur. And you know what happened to the dinosaurs?
Oh, we do. I think that's interesting that you say that, because we actually had this honorary award given to one of the giants in our field, Dr. John Tabbets. And he's well known for introducing many, not only techniques, but devices actually into the world of plastic surgery. And that was one thing he always tried to kind of hammer into his trainees, into his own family, into his friends, is that you can't continue to always do the same thing. He said, question everything you've been taught, every rule. And just because it's a rule doesn't mean that it's right, or that you have to keep doing it forever and ever. So I think that kind of goes along with the same thing of not being dogmatic, is yes, get your learning and your training, and then question it. Is that the best technique? Is there maybe something better? And maybe there is, maybe there isn't, but you got to question. You got to,
and that's the only way you evolve as a plastic surgeon, because I can tell you that we as plastic surgeons have the ultimate learning experience in that we get to watch our patients heal. Like, we do surgery and we use everything that we know, that we've been taught, that we've learned, that we've developed. And the way that we learn is we see how they've healed and how they do over time. And that allows us to have the experience to get better on the next operation for the next patient. And I say that I improve my operations while they're happening. I've surgical, suture tensioning, everything from, that graft could be a little thinner. Maybe I could have gotten this kind of support this way. And you have to understand that every patient deserves your utmost attention, the most that you can do as a surgeon every single time you walk into the operating room.
1,000%. Well, is there any new technique then that you are going to bring home from this meeting, or something that makes you, question what you do?
Well, I just discussed the surgical net with my facelift patient.
Oh, hey, that is
and
is a thing.
Do you know what face she made when I did that? She went, yee.
Ooh.
Yeah, so I'll keep trying, but I will tell you that I don't know about. So you and I sat there listening to these experts who love doing the surgical net, the hemostatic net as they sew the skin down to the facelift flap underneath.
So this
because they don't have to use drains.
Right. So this is after a facelift. You've done all the work. You've lifted everything. You've cut the skin off. And sort of as a form of a dressing, you're doing these external sutures. So going through the surface of the skin and suturing that skin down to the deeper structures to keep it where you want it, keep things from sliding around, prevent fluid accumulations, things like that. And it all makes sense. But the appearance of it is frightening
it's
to the patients that aren't expecting that. You look like you have, as one of our patients said, staples all over your face, like literally all over your face and neck.
Did you ever see the movie Hellraiser?
No.
Okay, so this is a movie probably before you were born. No, probably about the time you were born, where this guy had like very organized systems of nails coming out of his face, and it looks a lot like Hellraiser.
Right.
So from my standpoint, it's tough to look at, but I get their point. So I of course, having an open mind, said, you know what? Let me find out. It's not difficult. It's just stitching the skin down.
It's not permanent.
No, and it's only for 2 or 3 days.
Yes, after 2 or 3 days, the sutures are removed.
That's it.
You're not walking around like that. It's during the downtime, and you're going to be sitting at home anyways.
No drains.
No drains. It's just you got to get your patients prepared for it.
They got to be ready.
Yes.
Now, my patient today is
not ready.
Well, she's an experienced. She's in the industry. I can't say what she does, but let's just say she has intimate knowledge of plastic surgery and understands what it is to do that. So her response was, yeesh, can't you just put drains? I said,
yes.
I've been doing that for 30 years and they've worked great. Yes. And it's not like my faceless. So once again, the way that I always look at it, does this technique solve a problem? Do I have a problem that I need to solve? And the only thing that I can think about with the hemostatic net, with that surgical netting that you do with it's with nylon suture. The only thing I can think that would be an advantage to that would be that you would really have almost no chance of a hematoma.
Yeah, I don't know that that's true.
Well, I don't know that that's true either.
I mean, that
I didn't see any data on that.
Proposition of it, but if you have enough bleeding and you have a large enough pumper, it'll find a way to seep out of the incisions, out of the ear. It'll find a way. it may decrease the chances, but to say you will never have a hematoma, I don't know that that's true. I like it more of the idea of redraping the skin where you want it. I do that with my mastectomy reconstructions.
Right.
I put that nipple where I want it. I tape it down. I suck it down. So I could kind of see it from that standpoint, to really lay the skin in a place that you want it. So I'm open to it, but yeah, you got to find the right patient. I think once you do it all the time, your patients come in expecting that, but for the uninitiated, it is a big ask.
It was going to be a tough one. Yeah. So I was not able to sell that at all. But I'm going to keep trying, and there will be one where I'll say I'm going to do this because you need to do it. I'm not going to really kind of see how they feel about it. I knew this patient was probably not the one to do it on, unless they're like, oh my God, I love the hemostatic net. Yes, so do that for me. That wasn't the case. Right. And that was somebody with experience. Who can say, "What, are you crazy? Are you crazy? That's crazy." By the way, because we're doing this podcast out here, I have to kind of quote the Blake Griffin shit people say in L.A.
Shit people say in L.A. is the best.
It's a very, very good.
Because it is
so
spot
true.
on.
So I might say, not only as his point was, I'm thinking about doing a podcast. I really think I have something to say. I'd say, I think about putting a billboard up on 3rd Street and doing a podcast because I really think I got something to say.
I think we just added to that. Yes.
I think that's the additional piece. So what did you find? What was your, you did all those very difficult breast sessions.
I did. Yeah,
What was the home run? Are we just doing subcutaneous reconstructions now, or what's the deal? The muscle, forget it?
Well, that's in the reconstruction world, and I think what I was really focusing on was it is reconstruction, but revision breast and complex breast surgeries. And what I really sort of took home from it was that I should just be putting Galaflex in everybody. Galaflex is a synthetic mesh. It's absorbable, and I typically use it in complex breast where I need to, redo a IMF fold. I need to restructure the capsule. I need to reinforce some really thin tissues. So for the kind of complex stuff I do, it works really well. But a lot of these surgeons are sort of just putting it routinely in all of their mastopexy augmentations. Any revision breast is getting Galaflex. It's just being really more widely used than I am currently using it. And I'm not opposed to using it more often. I think it's great. I really do think that it adds a lot of value to the surgery. So I think maybe I should just be doing it in everybody.
Yeah, I mean, it helps a lot. I have seen some issues with it. And by the way, just for the Sunshine Act issue with the fact that we're talking about these products, I have no disclosures about being involved with any of these companies. I don't receive royalties or anything from any of these corporations. They're not advertisers. We don't work with them. No disclosures.
Although we are open to it.
We are.
Galatea
we would like to have
Bard.
disclosures. Yeah. Hi. Yeah. So if you want us to have disclosures, call me. But yeah, I mean, this is stuff that I use a lot too. I saw a patient back today with the Galaflex in, and it did really well for her. But I'm now going to move to the shoelace bra.
Love the shoelace.
I know I probably don't need it, but I love the shoelace bra.
I love it. It lets me sleep better at night.
Yeah.
It
So
really
what
does.
we're talking about is we take those ultra thick hip hop shoelaces.
Mm-hmm, the kind you put in your sneakers.
Yeah, exactly.
They come in pink, blue,
I
orange,
get them in pink
yellow.
for the ladies. I think they like the pink ones better. And then I guess the white also is good for under the clothing.
I like the black for kind of a kinky look, but whatever.
You can pick. but the bottom line is you go around the neck, you create a knot, and then you go all the way around the back at the IMF, at the inframammary fold, and it basically holds there.
It's like a splint for the fold.
I think it was Dan Mills that invented that, wasn't it?
Yep.
Yeah, so I want to credit Dr. Dan Mills. He was the one who kind of really relied on this and demoed it. And I don't know how he came up to it, but I think he did a lot of transaxillary augs and he did his revisions so that like sewing the inframammary fold wasn't really you can't really do that through the armpit. I mean, I'm sure you can, but it's probably a flogging at best. So anyway, I like the Galaflex. I'm into it. I use it a lot, and I agree with you. For the complex breast cases, it's
Game
reliable.
Changer. Yep, I love
100%.
it.
Anything else? Any fancy devices that you were into?
No. I think I just enjoyed perusing. I didn't really find anything. I mean, we have so many good toys already at Roxbury. We have the Renuvion, the Morpheus, the Potenza, we got so much. There's not anything that we need, I feel like. So I'm happy with what we have.
I did like the devices that I found at the Walt Grace Vintage Cars and Guitars party.
So we had that. We had a Aesthetic Fellowship of Los Angeles party.
That was sponsored by MERS
Sponsored
Aesthetics.
by MERS.
So I will say that.
Yes.
Even though I don't have any relationship with MERS, they sponsored our fellowship party, which was awesome.
Right. MERS produces Zeoman. They have the Bellatero products.
Yep.
They have
and Radius.
And Radius. They have a bunch of products out there. They sponsored the party, which was very nice of them. Very generous. And we just had a great time, visiting with past and previous and current and future fellows, as well as the rest of Los Angeles and the United States, people that came to support and visit us. And
it was awesome.
And it was great to see all these people in one place. And as I think one visitor said, what was the deal with all of those honeys that were there?
That was my brother. He was like, I got to talk to you. He goes, my brother, I don't know if you got to talk to him. He's very funny, but he kind of talks he jerseys it out of the side of his mouth. He's like, what's all the honeys? I was that's kind of plastic surgery. Yeah. Girls get dressed up. The guys try to look good too, but the girls blow the dudes out of the water.
It's
not even
and
close.
They're new and
plastic surgery people really go for it, and the women do. They set a different standard. They do. They look great. Looking. Yeah, and they take care of themselves. Yes. They really are representatives of the industry. And I think, when your patients see you, they want you to look like you're well put together. Unlike my hair, I get it. I'm working on it, but I had to grow it out a little bit for a purpose. Just make sure I could still do it. I think it was really sort of the purpose. Can
I tell you one quick story just to close this whole thing off?
Yeah.
And it's a perfect ending. So on our way here to do this podcast in front of the billboard about our podcast, we stopped at a liquor store because we wanted to get some champagne to mark the occasion.
Sure.
So I go into the store, I get the champagne, I go up to the counter, and the guy, asks for my ID, which they have to do, right? Because it's just sort of a deal. And he looks at my ID and he does one of these things. Really? Wow. Gosh. You don't look like that at all. Or you don't look that old at all. You look great. His eyes were doing these bug eye thing. I'm not going to say what year was on that ID.
That's right.
But whatever it was, he was like, wow. So that's just we are representatives of what we do. I definitely partake.
Yes.
And that is why
you do most of it yourself.
It's true.
Standing in front of a mirror with the Morpheus. Ka-chunk,
I do
ka-chunk,
everything that
ka-chunk.
I can do that doesn't require general anesthesia.
I offered to inject your Botox. You're like, no.
Did I?
Are you crazy?
That down. I was like, ugh, no, I know my face better than you. Thank you. No.
I like somebody doing. I don't know that I could try it. I guess I don't know how I would do on myself with injecting Botox.
I'll inject you. Don't worry about it.
Thank you very much.
Yes.
Yeah, I always because there's a very specific just please put it here, and I'm not sure I would get the right. I don't know. Maybe I would.
Be fine.
Well, anyway, should we pop that champagne?
We should. Yes.
All right. You. Why don't you hold the microphones, both of them, and then I'll see if I can pop it.
Okay.
Or do you want to pop it? I'll set it up.
I'll pop it.
All right. But let me set it up for you.
Okay.
Good.
It's in the fancy bag.
I think there's I'm pretty sure there are open container laws that we'll be breaking when we do this.
I know.
But,
I think as long as we don't pour it in cups, it'll be fine.
We're not gonna drink it.
I mean, it's still technically an open container. We just won't drink it.
Yeah, so everybody, just give us a break.
Just give us a break.
Just
Gosh darn it. It's our freaking billboard. Just give us a minute.
Act like it's Martinelli's or something.
There you go. Non-alcoholic.
The Martinelli's don't pop like this.
No, they have a good pop.
Yeah,
they got a pop.
Actually,
They do. It's Martinelli's, people. It's Martinelli's.
Yeah, my kids like that. We have no financial interest in Martinelli's either. I think we have to say that also.
Or the gas station Shandon.
All right, so this is up to you.
Well,
I'll take these. You're set. You got to pop this off and then do it.
Alrighty.
Don't aim it at the street.
I'm not gonna. I was a bartender. I know how to open a bottle of champagne.
Put it. See if you can put it up on the roof of this thing here. I'm not gonna fly Something else. Are you sure?
We would get sued if I popped somebody in the eyeball with this.
Oh, don't point it at me. Oh, that's a good point. Here it goes. I want the sound.
Sean, I'm gonna have to edit this. Gosh darn it. loosening.
Here, let me loosen it up for you. Don't aim it at your abdomen. You're gonna die.
Well, it's not even loose.
Here, I got you.
Don't pop it again, buddy.
Oh, this is gonna come right out. Maybe not.
I know. It's really.
Oh,
you ready?
Goes.
Ready?
Right.
Woohoo!
I wanted to fly it.
Billboard. Plastic Surgery Podcast, Beverly Hills.
Feel free to insert an actual sound bite of a pop there. That one wasn't any good. So that's it, eh?
That's it, eh?
All right. Well, then this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210. We're actually not in the 90210.
No, I don't know. We're like the 902...
Something else. The West
06?
Hollywood-ish. Something like
sure.
that. But we'll say from the 90210.
Well, West Hollywood is 90069.
Well, are we in West Hollywood?
We might be.
All right. Anyway, we're done. Congratulations.
Congratulations.